Welcome. In this video, we'll be exploring stroke, a serious medical condition that affects millions worldwide. We'll delve into what causes it, how it impacts the brain, what the warning signs are, and how it's treated. Our goal is to provide you with a comprehensive understanding of stroke, so you can be informed and proactive about your health and the health of those around you. Stroke, sometimes referred to as a brain attack, primarily occurs when the blood supply to the brain is interrupted. This interruption can stem from a few key causes. The most common is a blockage in an artery leading to the brain, often due to a blood clot. This is known as an ischemic stroke. Another cause is the rupture of a blood vessel in the brain, leading to bleeding. This is called a hemorrhagic stroke. Less frequently, a transient ischemic attack, or TIA, sometimes called a mini-stroke, occurs when blood flow is temporarily reduced, causing stroke-like symptoms that resolve quickly, but this is a warning sign of a possible stroke in the future. Risk factors like high blood pressure, high cholesterol, smoking, diabetes, and heart disease can all significantly increase the likelihood of experiencing a stroke. When blood flow to the brain is disrupted, brain cells are quickly deprived of oxygen and nutrients. This deprivation leads to a cascade of events at the cellular level. Without oxygen, the cells cannot produce energy and begin to die off. This cell death causes damage to the affected area of the brain. The specific neurological functions controlled by that area are then impaired. In ischemic strokes, the lack of blood flow causes a core area of irreversible damage, surrounded by a penumbra, an area of potentially salvageable tissue if blood flow is restored quickly. In hemorrhagic strokes, the bleeding increases pressure within the skull, causing further damage by compressing brain tissue and disrupting blood flow throughout the brain. Stroke is a significant public health concern. Each year, hundreds of thousands of people in the United States and millions worldwide experience a stroke. The risk of stroke increases with age. Certain populations, including African Americans, have a higher risk than others. Furthermore, individuals with a family history of stroke, or those with pre-existing conditions like atrial fibrillation, are also at greater risk. Understanding these epidemiological factors is vital for targeting prevention efforts and improving health outcomes for those at higher risk. Recognizing the signs and symptoms of stroke is crucial for timely intervention. Remember the acronym BE-FAST. B stands for balance. Look for a sudden loss of balance or coordination. E stands for eyes. Watch for sudden vision changes in one or both eyes. F stands for face. Look for an uneven smile or facial drooping. A stands for arm. Check if one arm is weak or numb. S stands for speech. Listen for slurred speech or difficulty speaking or understanding. T stands for time. If you observe any of these symptoms, it is time to call emergency services immediately. Time is brain, and every minute counts in minimizing brain damage. Diagnosing a stroke quickly and accurately is essential for guiding treatment decisions. A healthcare professional will conduct a neurological exam to assess reflexes, motor skills, and cognitive function. Brain imaging, such as a CT scan or MRI, is crucial to visualize the brain and determine the type of stroke, either ischemic or hemorrhagic. CT scans are often performed first due to their speed and availability. MRIs offer more detailed images, but take longer. Other diagnostic tests may include blood tests to check for clotting disorders and an electrocardiogram, or EKG, to assess heart rhythm, as atrial fibrillation is a major risk factor. There are two primary categories of stroke. Ischemic strokes, which account for the majority of cases, are caused by a blockage in a blood vessel. Within this category, there are subtypes, such as thrombotic strokes, caused by a blood clot forming in an artery supplying the brain, and embolic strokes, caused by a clot traveling from elsewhere in the body to the brain. Hemorrhagic strokes, on the other hand, involve bleeding in the brain. These are further classified as intracerebral hemorrhages, bleeding within the brain tissue itself, and subarachnoid hemorrhages, bleeding in the space surrounding the brain. Treatment for stroke depends on the type and severity of the event. For ischemic strokes, the primary goal is to restore blood flow to the brain as quickly as possible. This may involve administering a clot-busting drug called tissue plasminogen activator, or TPA, within a limited time window from symptom onset. Mechanical thrombectomy, a procedure where a catheter is used to physically remove the clot from the affected blood vessel, may also be performed. For hemorrhagic strokes, treatment focuses on controlling the bleeding and reducing pressure within the brain. This may involve medications to lower blood pressure and, in some cases, surgical intervention to remove the blood or repair the damaged blood vessel. Rehabilitation is a vital component of stroke recovery. This may involve physical therapy, occupational therapy, and speech therapy to help patients regain lost function and improve their quality of life. Preventing stroke involves managing modifiable risk factors. This includes maintaining a healthy blood pressure through diet and exercise, managing cholesterol levels with medication, if necessary, controlling diabetes, quitting smoking, and maintaining a healthy weight. For individuals with atrial fibrillation, blood thinning medications may be prescribed to reduce the risk of clot formation. Adopting a healthy lifestyle can significantly reduce the risk of stroke and improve overall cardiovascular health. The prognosis for stroke survivors varies depending on the severity of the stroke, the affected area of the brain, and the speed with which treatment is received. Some individuals may make a full recovery, while others may experience long-term disabilities. Research is ongoing to develop new and improved treatments for stroke. One promising area of research is neuroprotection, which aims to protect brain cells from further damage after a stroke. Other research focuses on developing new rehabilitation techniques to enhance recovery. Stem cell therapy is also being explored as a potential treatment for stroke in the future. Understanding stroke and supporting ongoing research is essential to improving the lives of those affected by this devastating condition. Thanks for watching.